thank you all for joining our webinar on supporting birthing people and care teams. My name is Sarah Verbeest, and I am at the University of North Carolina at Chapel Hill. And today I am wearing two hats. The first hat I'm wearing is as someone who is part of the National Maternal Health Learning and Innovation Center. And we are really excited to be partnering with the Maternal Health Learning and Innovation Center to present this webinar. So we are not going to give introductions, but we have a lot of members of our team that are joining us today for the presentation. So you will hear today from 5 of those of us who are part of the fourth trimester team. We are so fortunate that we have partners from across the state and country that work with us, and we're honored to represent them today. We also want to offer gratitude to our funders. So our project is funded through the Maternal Health Innovation work. We are part of North Carolina's Maternal Health Innovation team, and notice that we have our colleagues from North Carolina Maternal Health Innovation in the room today. We appreciate all of the support that you offer us, and we are really grateful for the work that we've been able to do with these resources. So the mission of the fourth trimester is to change the way America treats new parents. And we really like elevating this quote from our colleague, Dr. Amelia Gibson, because motherhood should not mean risking your happiness, health, or life. And while survival is important, really our hearts beat towards having new parents thrive as they enter in this really exciting time in their lives. And this really matters. So for many, many years, people were not talking at all about the postpartum period. We focused pretty intensively on prenatal care. And as we have done more to understand and study data related to maternal mortality and maternal morbidity, we've come to understand that the postpartum period really matters. We know that of all of the cases of maternal mortality, over 80% of those were determined to be preventable. And we know that the timing of when pregnancy-related deaths occur, over half are occurring from 1 week to 1 year postpartum. So we appreciate you all joining us in this work and thinking about how we can provide better care during this really, really fragile and important time. Just a little bit more about us. As I mentioned, our project is based at the University of North Carolina at Chapel Hill, and we are a partnership between the Schools of Medicine and Social Work and many others. Our work represents a collaboration of diverse professionals and community leaders and new parents from across our state and country, and to those of our partners that are joining us today. Again, thank you for all that you do to make this work power forward. Community engagement and co-design really guide our work, and you'll hear that as we go. And we also center the needs of those put at risk by society. As I mentioned, listening to new mothers is really important to us, and we share this picture because the fourth trimester was birthed many years ago, way back in 2016, with a project that we did where we spent 2 years intensively listening and understanding the postpartum experience. We've also had focus groups. We've done online, in-person listening to really understand the challenges for both birthing parents as well as the folks that care about them. And while we don't have time to fully unpack everything that's contained on this slide, this is an image that has emerged from our early work, and it highlights the complexity of the postpartum period and the significant tasks that a birthing parent and a new family are trying to accomplish. So we think about mood and the emotional needs that we see that manifest in this really special period of time. We think about infant care and feeding. So we hear a lot about the stress of infant feeding, lactation, and supports. We talk a lot about contraception and birth spacing, but less about intimacy and sexuality in relationships. We see that understanding about sleep and fatigue is a kind of a common part of the postpartum experience, yes, but its impact on mood and Sexuality and recovery and substance use is often not something that we really think and unpack as much as we should. And you'll see so there's a lot going on, physical recovery, as well as sorting out medications and different exposures. And in the meantime, people are trying to take care of their baby, their relationships, their family, themselves, and also thinking about their new identity as the parent of a new child and a larger family. The work that we have been able to do through our current project and through other projects has had us unpacking the postpartum experience and postpartum care from a wide variety of perspectives. So we have really done extensive work in thinking about the postpartum experience in the neonatal intensive care setting, for example. We worked closely with health departments where we co-designed some of our materials, particularly our Taking Care of You and Birth Control After Baby booklets. We have an entire postnatal patient safety learning lab that's looking at how we can address respectful perinatal care. And for the purposes of our postpartum work, thinking about those transitions of care from labor and delivery to the postpartum unit to home. We've worked on the postpartum discharge transition bundle, and our Believe study is really focusing on interdisciplinary training that is helping to make the healthcare system better so that birthing people and healthcare workers are treated with respect and care. So basically, our team absolutely loves the postpartum period. So we want to focus our time with you today on the current project that we have. And our goal has been to improve postpartum care for people across North Carolina. And when we designed our current work, we built it on a couple of cornerstones of also research. So the first is thinking about how we build supports for the postpartum visit. So traditionally, people come in at 6 weeks after they've had a baby for a visit. That visit is not generally very well attended. And so back in 2016, there was a national think tank on the postpartum visit and care, and really identified how we need multifaceted approaches to make sure that birthing folks are getting in for care and making sure that the care they receive is what they need. And so as we were designing this project, we were very excited that partway through the project, we were able to have postpartum Medicaid expansion in North Carolina, which has really been a really wonderful addition for us here in the state. We thought about how you prepare for a postpartum visit and know that that preparation actually starts during prenatal care. And so we've designed a postpartum plan that you'll hear about later and a checklist to really support preparation and the quality of that visit. We think a lot about how we support healthcare system changes, such as thinking about open access appointments, making sure that appointment reminders are sent in a variety of ways, etc. We want to make sure that the timing of visit is meeting the needs of when the person needs to be seen, and that when they're seen, that they're actually having an opportunity to direct the visit to make sure that what is troubling them is addressed. And we know across all of the spectrum that the importance of building trust really matters, particularly in this really vulnerable and sensitive postpartum period. So if you want to dive in more, there is an entire issue back in November 2016 about postpartum health and wellness that's available for free. We also layered a lot of our work on the new committee opinion that came out from the American College of Obstetricians and Gynecologists. And our colleague, Dr. Allison Stubbe, who's one of the co-founding mamas, led that work. And so the tools that we developed for this project were also intended to be complementary to the guidelines and to the suggestions and recommendations that came out through that committee opinion. And one thing that we wanted to just highlight for you all today that we think is particularly significant was the focus on contacting all women within 3 weeks after giving birth and creating opportunities for more frequent check-ins and earlier check-ins than what originally was that traditional 6-week visit. And this is a way to make that visit more patient-centered. And we think that is another way that could increase uptake of postpartum visits. So our approach has been to really uplift the challenges and needs of new parents, to improve clinical care with mom-centered strategies, to provide information about postpartum care and supports to new mothers and those who love and care for them. There's such a need for more information out there, and we've been honored to be able to do what we can to meet some of that need, as you'll hear about later. And we also want to create space for important conversations on policy changes and quality care metrics. And so with that, I am turning the stage over to Nkechi Charles.
Hi, thank you. You can go ahead and go to the next slide. So our community partners have played a very strategic role in evaluating our tools. We would like to take the time to thank Mahogany Milk, Mama's Village, Fayetteville, and Citygate Dream Center. Together, we have engaged with 317 birthing parents from across all the regions of the state in English and in Spanish, and they've given us valuable feedback on our tools and our websites. Next slide. Through our community partners, we were given the privilege of listening to parents' postpartum experiences. And some of the barriers to postpartum care, including concerns as to whether the postpartum visit and care was covered by insurance. Two notable challenges preventing some of the two notable challenges preventing parents from attending the postpartum visit included lack of transportation, as well as lack of childcare. A lot of times we have parents who have multiple children and they have no one to watch their children, so they opt not to go to the postpartum visit. Mothers also express frustration not knowing what health symptoms that they should be concerned about and wanting to learn more about how to cope with the stressors during the postpartum period. Some of the unmet postpartum care and education needs included maternal health warning signs, information about maternal health and emotional support for mothers and partners, as well as physical recovery that takes place during the postpartum period. Now, one thing I do want to highlight, and that was one of our biggest lessons, was just the strategic role of the community partners themselves. Here you'll see one of my preferred definitions of resilience. Often it's referred to as bouncing back, but this is by sociologist Michael Ungar, who defines resilience as the individual capacity to navigate towards and negotiate for health-sustaining resources, as well as the capacity for her environment to provide these resources in a meaningful way. Now, as our different community partners were bringing women together and they're giving feedback about our tools and also sharing their stories, it was exciting to see organically that they were creating their own postpartum village. And they all showed excitement of how can we maintain these relationships so we can support one another through it. And that's ultimately what we want. We want to make sure that no one's going through the postpartum period alone. And having people who are like-minded in a similar season can definitely provide that social peer support that is so important and valuable. Next slide. And so from our collaboration with our community partners and providers, they informed the creation of our postpartum toolkit and all the great feedback that we've gotten. Our postpartum toolkit is available on our newmomhealth.com. We have various resources that parents and providers can use alike. Excuse me. We have the postpartum visit checklist, things to think about when you're going through the postpartum visit to make sure that parents can feel like they're getting the topics that they want to talk about, they can share with their provider. We have a postpartum and intimacy checklist, things to think about during the postpartum period. We also have a postpartum plan for new parents, which I use for my second child, and it's so helpful just to sort of think ahead. We do all this time to prepare for the baby to come, but after the baby's come, what are the needs that the birthing parent may need, or their partner, or as a family, in terms of visitors or other forms of support that they may need during that time period. And we also have the Taking Care of You, which Sarah mentioned earlier. And what I love about the Taking Care of You is it really allows you to sort of think through the postpartum recovery and the kind of support that one will need. And we have that available in English and in Spanish. New slide. Next slide. Thank you. In addition to these tools, we also recognize there's the importance of addressing social determinants of health. As you heard me say previously, there are some individuals who expressed challenges for transportation or even challenges with childcare. So we're so grateful for the work of Dr. Tully and her colleagues that in this area. And some of the key takeaways that we've learned is when possible, normalize that everyone benefits from support and offer everyone resources. Don't screen for something that you can't help address. Be aware if someone shares that they have a need, that they have taken a risk telling you, so treat them with care. And we should incentivize resource provision instead of only focusing on the screening. Now, next slide. Now we're going to go into moving on how we can begin implementing the 4th trimester tool into practice. Next slide. So our implementation process was informed by the normalization process theory. Basically, that just helps us think of ways in which we can normalize new interventions into everyday practice. So typically, we are approached for technical assistance as a result from one of our 4th trimester presentations that we offer, just to share about the importance of tending to the postpartum period and other special topics related to the postpartum period. Once a site has indicated interest in technical assistance, we conduct a readiness assessment and help them identify one tool to focus on. And I just want to emphasize that we intentionally focus on one tool often enough when there's implementation. There are those who have great vision and want to change and revamp everything. And we've learned that when we're integrating new tools into the contextual reality of a site, it's important to focus on one tool first. And that enables us to go through the process of what does it mean to actually integrate into the existing practices, what things need to be adjusted. And through that consulting engagement, we can be able to see, okay, this is the one tool that we successfully implemented. Now we know how to repeat that over time for other areas in which we want to expand into our postpartum care. And so next slide. And so during our engagement, there are 4 questions I want people to keep in mind. It's based on the normalization process theory, is the what, the who, the how, and the why. And so when we are clear on the what, the who, the how, and the why in implementation, it ensures that that whatever intervention is done is sustainable. So everyone who's involved in providing this new tool or these new resources in postpartum care at a site, everyone's very clear on what the intervention is, and it makes sense to everyone as to what it is and why it is important, who's responsible for carrying out that intervention, and are those who are involved in carrying out the intervention, are they committed and engaged? Clarity as to how it's going to get done, how I'm going to make it work in our clinical practice, and then why. Why did it happen the way it did? So there are ways that in which we can improve it to make sure it makes sense in the context and it's sustainable. Then we'll make those adjustments. And that cycle keeps on going on and on and on in that respect. Next slide. Now I'll shift it over to Rachel.
Thanks, Nkechi. So I do want to spend some time talking about how this looks like in a case study. So we're going to talk about what we call Site A. So just a description of this site. It was a pretty large health system comprised of 10 different clinics or sites, and pretty much all these sites were providing prenatal and postpartum care to some extent. So they really wanted to improve their postpartum care through revamping their prenatal care packets. Basically, when we started working with them, their prenatal packets were decentralized. So meaning that, each site did it a different way. And some of the challenges that we saw were the contents were inconsistent. So even though they kept all their files on a shared drive on the computer, each site was uploading different documents into the file. So there really was no consistency in that. And then in terms of when they were giving out the packets, some sites had a packet that they gave out, at the first visit. Some were doing them in the 2nd trimester, some were doing them in that 3rd trimester. So it really varied on each site. There was also no point person for ordering. So, once materials were out, who's going to order some more? Who's actually putting these packets together? Most of the sites use medical assistants who are in charge of putting them together. but this also varied based on the site. So some of the sites had an assigned medical assistant that, it was their task. And, every time the packets were running low, this was the person that would put them together. Some of them had them assigned as a medical assistant downtime tasks, meaning, hey, you're not, rooming a patient right now, maybe go check on the packets and see if they're running low. And then some of the sites really had no workflow in place due to high staff turnover. So they really had no, good routine down. There was also no consistency in the documentation. So some providers would document, when they gave out a packet or what kind of education they did with that. And then others didn't document that at all. High clinic staff turnover was an issue for some of the sites, and they really had no implementation plan in place when we started working with them. Next slide, please. So our technical assistance goal in working with them was we wanted to support the healthcare system in establishing a standardized implementation process to integrate postpartum education as part of the patient engagement. So some of the things that we worked through with them was selecting which site to pilot this at. So some of the things that they had to think about was, do we want to pilot this at a site where they really had no routine in place, because it might be easier to come in and start something new at that site? Or do we want to pilot it at a place, where they are more fully staffed and they kind of have a set workflow in place, but at the same time, it might be a little harder to introduce something new. We also had to get them to think about how to establish consistency in terms of the content collation. So do you want to get together a group maybe quarterly to go through the resources and think about what you're giving out in the packets? How are you going to maintain supply? So who's going to be doing the ordering? Who's going to put the packets together? Who's actually going to put the packets in the room? Who's going to give it out to the patient? And then also timing of dissemination. So we really wanted it, or they wanted it to be standardized across all the sites. So when are you going to give it out? Is it going to be at the 28-week visit because patients are there a little longer and you have a little more time to do education? Or do you want to do it closer to, when the patient's going to deliver? So they had to think about that. And then fidelity. So we want each site to be able to uphold, what the things that they had decided were important for all of them, who's going to be in charge of making sure things get done in a timely manner. So we did come up with some task management plans, which we put together some worksheets for them in terms of going through and thinking about all these different key decisions and actually filling in like which staff is going to be responsible for all these things. Next slide, please. So this is the postpartum care plan, and it was co-designed working with UNC. So the postpartum care plan is a tool that is really intended to be filled out by the provider and the birthing parent together during their visits. So it's got spots to put in, who your providers are, pediatrician, lactation support, maybe they're working with a therapist, their contact information. It's got spots to put in when their follow-up appointments are going to be during that postpartum period, any medications that they're on. So this is really to get the patient and the provider thinking about how this patient can be best supported during that postpartum period. And through working with UNC, we were able to co-design this tool together. And Dr. Nargis Fari is one of the doctors that we worked with. And this is a quote from her. She said, "We have been working with the Fourth Trimester Project to implement the postpartum care plan to provide more comprehensive postpartum visits and improve postpartum visit rates in our health centers. By incorporating these materials, starting in prenatal visits and incorporating a team-based care model, we have been able to increase our postpartum visit rate to over 90%. So that just goes to show that, when you're able to implement this well, it can really improve the postpartum care. This right here is one of our more popular tools. So this is called the our one pagers. So we've got a one pager for the birthing parent and then a one pager for the baby. And the way it's broken down is that red box goes through symptoms to really be on the lookout for. If you're noticing this, you need to go back to the hospital or call 911 right away. And then that orange box is kind of like good things to look out for. So if you're noticing this, you might not need to go to right back to the hospital, but you definitely should call your provider. And then that green box goes through just some good tips on taking care of yourself in that postpartum period, and then also how to take care of your newborn baby. So this is a popular tool that our health departments like because they're one page, they're really great and easy to hand out. It's very simple to look through. So when you're doing education on things to look out for, it's very convenient when working with patients. I think Kimberly works some with the health departments. Do you have any input you want to give in terms of how that experience was?
Sure. We have several health departments within North Carolina that have integrated this one pager into their education for both in their prenatal period and in the postpartum period to help individuals know more about the postpartum, what to expect, and also when to call for maternal warning signs. This tool has also been integrated into UNC, into the medical center for postpartum discharge. So this has been added to their AVS and given at discharge so that they can actually have this available. And it's not just within one UNC hospital, but also within the UNC medical center, medical system.
Great, thank you. Next slide, please. So you can work with us in a variety of ways. So we do have like tips that we came up with for each of our tools. So when you're kind of selecting a tool to implement at your site, you can go on our website and look at our tips on how to implement it. It goes over the purpose of the tool, how to use the tool, when you might want to think about giving it any special considerations. We also have a little handy like video reel we've put together on how to do that as well. And then we also have we have a slide deck that goes through that as well. So we have a variety of ways to help you, think about how you're going to incorporate these tools. And then in addition, we have the technical assistance. So if you wanted to work with us on a more ongoing basis, we're definitely there for that as well. Next slide, please. So just to kind of like summarize some of the challenges and opportunities we encountered during this implementation process. So I would say number one is definitely staffing at clinic sites. So, when your staffing is turning over every few months, it's really hard to get a good workflow in place. And with that also comes competing priorities and projects. So implementation is not a quick and easy thing. It involves a lot of internal meetings, within the health system, and then also meeting with us to work through that process. And then each site also needs an implementation leader to kind of oversee and organize all the meetings and get back to us about that. And then I'll turn it over to Kimberly to talk about some of the opportunities that she's seen.
So some of the opportunities that we've had as a project is being able to collaborate with different organizations and also just with different areas. So we think about initial collaboration with health payers. So for instance, collaborating with Blue Cross Blue Shield, they've been able to integrate some of our resources into their patient education portals and giving individuals access to that. We've also had the ability to collaborate with residency programs to look at systems changes and how you can improve rounding and education that's provided at different times. And then also being able to provide education such as the perinatal symposium and education for the healthcare team to improve the postpartum period. Slide. And so in this section, we're going to talk a little bit about the education and training that we've been able to do over the past few years in North Carolina. Next slide. So with our technical assistance, we've considered, as we mentioned before, utilizing the normalization process theory. And one of those thinks about what's the best place to start and what's the best context for your area, and thinking about the team flows, workflows, and process areas to help improve outcomes, and thinking about what measures and metrics that are that actually matter. So thinking about education and knowledge, increase in knowledge. So that's one of the areas that we often focus on when we first start with a site. They want to increase the knowledge that is gained from the healthcare team, and being able to know that the importance of the postpartum period, but then also thinking about the education and its transition to the patients and that are served during that time. We have the opportunity to come together to focus on, with each site, what their actual area of focus should be, whether it's actual implementation and thinking about how they can scale it across multiple sites, or thinking about implementation and sustainability, ensuring that all of the strategies they have in place continue on. Next slide. We have the opportunity to come together and provide education opportunities through community of practice, which offers an opportunity for sites to actually have conversation about the areas of need, but also thinking about our education that's needed as recommended or requested. The ones that are listed here are some of our more popular ones related to fatherhood and in the postpartum period, understanding the trauma of perinatal loss for patients and providers. And with that section, we really focused on what trauma and loss looks like, but then also what does that secondary trauma look like within the healthcare team, and how can we improve? And then the next one was listening to our Latina mothers and talking about our collaboration with community partners and how we can bring that information together. Within our community of practice, one of the areas that we like to highlight is within North Carolina, we've been able to crowdsource the topics and speakers, but we also have the opportunity to collaborate with other sites outside of North Carolina if that's of interest for you. Next slide. And as we mentioned earlier, we wanted to make sure that it's not just one individual, but we also have an interprofessional training model. So we've had the opportunity to do training, to integrate this fourth trimester education into our doula trainings within some of the partners we've had have been like within UNC, but also our lactation partners. It's been integrated into the program at North Carolina A&T and their lactation program, working with WIC and helping to provide this training across the different WIC areas, and then also our community health partners as well. Next slide. So coming this summer, we know that just providing training to the healthcare team and the individuals around is not enough. So we wanted to expand that into birth workers and healthcare professionals, especially community health workers, expanding our current trainings within doulas and also home visiting, but then also moving into the community members. So thinking about child care providers, faith communities, and local groups who can help support new families. We've been able to pilot a child care education session within one of our local universities, Child Development Center, and actually thinking about who are the first individuals to contact with those birthing people that have first gone back to work and who may be able to have exposure to the fourth trimester. Next slide. I'll turn it over to Suzanne.
Hey, next slide. So this website we've built, newmomhealth.com and saludmadre.com. It's really about getting, as Sarah mentioned, getting this information to moms and the people who care about them just in time, and making sure the right information comes to them in the right way, and that is impactful. It resonates with them. It's easy to understand. And that everyone's on the same page, speaking the same language. So we've done a lot of testing to make sure that the information and that the website and our social media is accurate and is, mom friendly, is provider friendly, and we're all speaking the same language. We've been able to really focus in North Carolina so far, and so we're thankful for that, and hopefully to being able to move more of our reach national. But even with our North Carolina unique and organic posts, meaning each person, when I do metrics, I say each person rather than impressions, how many times you've seen it. We've been able to reach over 1,200 people a day with our websites. This year we've had YouTube, over 201,000 YouTube views, and on Facebook and Instagram, over 451,000 impressions. We have a social media toolkit coming soon so that we can ask communities, ask communities to go ahead and share this information. We have these reels, we have toolkits available to, get the right information that's accurate for communities, for health systems, for groups to be able to post or repost our content as well. As Sarah said, with a lot of this is listening to moms, listening to the care teams, learning from them, working with these teams about, every different part of this education and dissemination, and then repeat. When we started in 2016, it's funny, I had both my kids at both the launches, so I know exactly how old the websites are. It really was mom and care team design. We went down to the tone, to the format, to the topics. We're doing upgrades right now on functionality and user experience, restructuring the layout, doing a whole platform reboot over the last year, and then really hearing from care teams wanting a resource search build where they could go in, and you see on that on the right hand of the screen, being able to browse for different type of resources. So when we say toolkit and they're wanting something that is one pager in Spanish that has icons, or something that a video that is in Spanish, or a comic book, whatever it may be, you can go in and search for our developed resources. Next slide. And a lot of this is having these strategic partnerships. So this is where we've been able to, throughout the years, this is just a few. We have had so many partnerships and so many partnership inquiries. Something that that we're kind of sticking to our core values is that we're very HUCO compliant. So we've had to turn some really cool opportunities down, but we've also been able to uplift and partner with some really great organizations in many different ways. Whether it be a social media campaign, or a national podcast, or a podcast that's specific to North Carolina, whether it be a Zoom module learning, or a national campaign for the Super Bowl with Baby Dove called the Under Pressure campaign. If you haven't seen it, I think it was 2 years ago, and it won a bunch of awards. This Under Pressure campaign about postpartum experience. Next slide. We were featured with the Maternal Health Learning Innovation Center at their symposium last year for innovating the way that patient education material and training is disseminated. And a lot of this was listening to moms about struggles that they have when they're, at discharge, and retaining information, feeling overwhelmed with information, saying, I wished I would have known, but where's that sweet spot of when to learn about it and when to talk about it? Because during pregnancy, I'm focused on labor, and then when you're in labor, you're focused, so when's the right time to get this information? And so when we created these reels, they're 90 seconds, and we partnered with Nurse Nikki, who we consider her a member of the team at this point, because we've done so much work with Nikki, and so thankful to have someone that's trusted and that's kind of a face that talks about, here's what's going on with your body. She can take very complex information about postpartum hormones or about blood pressure and make it really easy to understand and know what to look for. And what makes it innovative is that, there's audio, there's video, there's graphics and visuals, there's captions. It's done in English and in Spanish. And we've actually had a lot of groups reach out to have this embedded into training. So I know like the WIC has this in training now. So when anyone that's working in the WIC program, they now view some of these reels, because they're so snackable and easy to remember. It's a great way for things like when to call 911, when to call your provider, what's going on with your postpartum hormones 3 days after birth, what is blood pressure, things like that, where it's really easy to see it and understand in 90 seconds. Next slide. And I think we have time to watch one. Again, I think it's about 90 seconds. I think we have time.
Hi, I'm Nurse Nikki, family nurse practitioner, lactation consultant, and community health educator. I joined the Fourth Trimester Project team on their mission to change the way we care for and support postpartum parents. Welcome to our Fourth Trimester Facts video series. Today I want to talk to you about maternal health warning signs and symptoms, things that can happen before pregnancy and after pregnancy. Look, birth and labor is a whole process. Caring for yourself at home can be hard. You deserve support to heal and be well. This is a 3-part series where we will talk about when to call your doctor, when to call 911, and when you can handle some things at home. Today we'll cover when to go to the emergency room or when to call 911. So let's get into it. Now, all of these warning signs should absolutely be shared with your partner, support person, or family. Sometimes when you're feeling bad, you can't always recognize what's going on, but if someone in your space knows the signs, they can help you get the care you need. So what are we looking for? Sudden tiredness or weakness, difficulty breathing or chest pain, severe headache or changes in your vision, a high blood pressure, where the top number is 160 or higher and the bottom number is 110 or higher. We also want to look out for extreme changes in your mood. So if you have feelings of harming yourself, harming your baby or someone else, that's a sign we need to call 911. Any extreme worry, or you may be hearing things that nobody else can hear. These are all signs that you should call 911 and get the help you need when you need it most. Now swipe to see part 2, when to call your healthcare provider.
Thank you so much. Next slide. And not to mention, if you go to our Fourth Trimester Project Instagram, so it's at Fourth Tri Project on Instagram. You can view those reels. They're also on YouTube. And I'll say we had Dr. Allison Stubbe do one on postpartum hormones and what to expect. And there were over 250,000 views on that one. That one went viral. So that was exciting to see that it was so well received. And in fact, there is just a mass ask for more topics and more content, and taking, again, some of this really clinical stuff and making it really easy to understand. We also set a precedent with the CDC. So in 2022, we collaborated with the CDC to do the first ever state-specific health campaign. They have a lot of campaigns, but they had never partnered with an organization before to do a campaign. So we worked with their legal team and their PR team and a bunch of different teams to go hand in hand with how we can, how we might be able to make this work for North Carolina audiences. And it actually was very timely. It was during Allison Felix's last Olympic run. So we were able to work with Allison Felix's PR team as well and get a lot of fourth trimester North Carolina specific ads out there. And just over the summer alone, we had 5.4 million impressions from billboards across North Carolina radio ads. We were also on Spotify. We had social media ads running. Spanish newspaper and magazines were running, and then we had moms and influencers in North Carolina talking about postpartum maternal warning signs. Then in 2023, at the end of 2023, I believe it's continuing on to 2024, we collaborated with North Carolina Department of Public Health to continue the Hear Her North Carolina campaign. And we had photo shoots with moms specifically in North Carolina and clinicians in North Carolina, and we're continuing to do more to have more people and faces in North Carolina represented in our campaign materials. Next slide. I'll turn this over to Sarah.
Thanks, Suzanne. And y'all, please go ahead and put questions in the chat, because I think we will have time for question and answers. So how might you work with us? So one thing that we often have folks call us for help with is thinking about convening. So we do have a lot of experience in bringing new parents together, bringing communities together with other teams to really get their input on what matters to them, what is working for them. These are some images of some graphic art by Rio Holiday that we have used as another way of a tool to help people kind of diagram complex systems of care in their community and think about ways that they can streamline it. So we absolutely love sharing tips and ideas and strategies for listening to the people that we're trying to serve. If you're in North Carolina, and I know that there are those of you out there from North Carolina, we are available to help you integrate any of these tools or resources until the end of September this year for free. So please call us. We would love to connect. For everyone else out there, our team is happy to offer you a 30-minute free consult just to talk through the webinar, or if you're thinking about ideas or plans that you might have for your state or organization or clinic, we'd be happy to talk to you. We have consulted really widely on quality measures and metrics, as well as Medicaid supports. So would also be happy to talk with your Medicaid team or others of you as you're thinking about how to use that important care mechanism. We know that as states have rolled out postpartum Medicaid expansion, that what is covered can vary widely based on states. And so we would love to help support in that way as well. And the team is available to work with you as consultants or trainers, implementation experts, project support, speakers, workshop leaders. We are available to team with you and would love to. We also wanted to call attention to the soon to be released Practical Playbook 3, Working Together to Improve Maternal Health. This is a really amazing compilation of the work across data and innovations and equity and collaboration on maternal health. And we are excited because we have a chapter in there on the 4th Trimester Project. You can order that book today, but also it will be available eventually online free of charge. So we just wanted to put in a little promo for that. And as we kind of close with some opportunity for questions, we just really want to highlight that all new mothers and families need and deserve support, resources, and compassion. That this is really foundational to their well-being. It's foundational to our country. And elevating the importance that it is normal and necessary to ask for help and to provide help during this time has just been really important. And so we want to listen to you to think about how might we work together to co-create ecosystems of support to nourish new families, kind of leaning back to what Nkechi Charles was talking about earlier. How do we think about all of the different folks that are in community with new parents so that we can all work together with some common messages towards really helping make this a beautiful period of life. So again, a little shout out to our website. We really hope that you will consider using that in your practice and sharing that with others. We don't have a big national budget to get the word out, so I always love it when we have new folks using. You can follow us on social, and my cell phone is on the slide and available as well. So with that, I am going to stop sharing so that we can see all of you out there and have a little space for questions and answers.
Suzanne, you're muted.
I was saying there were some questions in the chat and I'm scrolling back up. Yes, it's recorded, and yes, there'll be slides sent out afterwards. Yes, you can use our social media tools, and in fact, we encourage it. Please do go on our social media and share things. We're building in the Resource Center, we're building a communications toolkit. It's currently under construction, but there will be where you can just easily see suggested captions, suggested graphics and videos that can go with those captions, and then it'll just post to your social media. And yes, please do. We'd love to be cited, so we would love to have you tag us or use our hashtag so we can see it and we can, reshare it. But yeah, please do. And the Resource Center, the toolkit that we're talking about, these tools you can see in the Resource Center, they are free and open access. You can download them, you can have them printed, you can use them in your organization. Be around a new mama, or a doula or a new mom or someone that's pregnant right now. Please do get it printed, and we'd love to hear what they think. What are some postpartum challenges you see in your clinics or states? I'm going to pass it up to the team.
Sure. Well, and I see a question from Caitlin Thomas. Thank you, Caitlin. So the question is, are we having discussions about postpartum care resources and recommendations beyond the 12 weeks? Yes. So as a team that has been kind of living and thinking about postpartum care since 2008, it seems like such a dream to actually have Medicaid expansion. For so long, as many of you know, we were so kind of constricted to being able to figure out what we could get in with that 4th trimester, because after that we didn't have access anymore. And so this is a absolutely wonderful opportunity, and we definitely as a team are looking for some resources to go back and engage new moms and helping them work with us to design what that would look like for them. There's also folks in North Carolina that have been thinking about transitions of care, so thinking about how do we do those warm handoffs from your OBGYN or the person that's given your postpartum visit to really connecting you with the other services that you need. So those are definitely conversations we're having and what we'd love to have with y'all. Other questions, pain points that you have in your state, anything else you'd like to know about what we've learned? We're all yours. I wonder, team, well, I've got my eye on the chat. Does anyone have one of our favorite tool that you want to share? Favorite tool. And as I mentioned in the chat earlier, we've also found that digital is important, but print is not dead, y'all.
So I'll have to say it's the video reel of the hormones. Dr. Stevie did a great job just summarizing what happens. And every time I show that to somebody, they're like, oh, wow, that explains it, right? And it's just amazing how much you can pack in 90 seconds. And that can definitely normalize the experience of becoming a parent, like reminding individuals like you're not the only one. And the tone is always welcoming. And I shared with the team when I was doing a focus group at City Gate Dream Center, they had, we were listening one in Spanish, and I was just watching the group and you can see the women engaging and just, they gave the video a round of applause. I was just sort of surprised. I'm like, well, why are you applauding? It's like, well, they're encouraging us. They understand what we're going through, and they really welcomed the message. And so those video reels have to be hands down my favorite tool.
I'll agree, just because I like to know. I think we've heard so much about wanting to know about why is this happening, not just like, yes, you can expect, it's a baby blues, you might get moody, you might be crying for nurses, but why is that happening to my body? And so the fact that we're hearing some like actual like scientific of like, so when you have your period, your hormones go from here to here, and when you're postpartum, it goes from here to here, and this is why and it really does take some, it just gives you context of what's happening to your body. And so whenever I showed it, my sister just had a baby, it was like, that makes so much sense. And she's a postpartum nurse, and even that, she was like, this is so great to be able to hear it this way and have the context of what's happening.
Yeah, I think a lot of our materials really shed light on what is this experience like, and it's really sad. I think sometimes the amount of silent suffering that people have out there about not knowing when to call, not knowing if this is normal, what is normal anyway. Anyone else? Rachel, our newest new mom on the team.
Yeah, so I just had my first one in October, about 4 months ago. And one of the tools that I really like is the postpartum plan. So it's a little different from the postpartum care plan, which I had mentioned earlier. But this is a tool where you basically hand it to the birthing parent, and they're intended to take it home and work through thinking about what their village of support is going to be for that postpartum period. Because I think a lot of times as a new parent, like planning for the birth of your baby, you spend baby stuff. So, the newest baby gadget, baby clothes, cribs, car seats, and things like that. But you don't give enough time spent thinking about yourself, like who's going to be taking you to your appointments? How are you going to be healing from the delivery process? Your mental health, who's going to make you meals, take you grocery shopping, who are you going to call when you're having issues with breastfeeding? So all of these things are laid out really nicely in that postpartum plan. And you can really encourage that parent to start filling it out in that third trimester, to be thinking about, how am I going to survive in that fourth trimester?
And Sarah, there's a comment, a question in chat on the working, how to use the resource. I would consider choosing one resource. So the question is, I work for Connecting New Jersey, a referral resource for pregnant individuals and families with young children. And I specifically work in a county with very little prenatal resources and little communication between towns, individuals, and resources. Any recommendations on how to use your resources in this type of setting? And so if you choose one, so like for instance, if you choose either the plan that Rachel was just talking about, or like the one pager that we have, and like choose one area of how you want to increase like this knowledge, you can either include it on have it access, and they can choose to receive that tool with them. And so then they're able to get the education about like the postpartum period, or just making it connected so that they can fill out by themselves, and how they could actually move forward with that. I know at one point we had mentioned kind of, I think, catchy, creating your own village, and kind of looking at what it looks like to have village toolkits to help people begin to have conversations within themselves. So I don't know, Catchy, if you want to mention or say anything to that.
Yeah, one thing I love about Kimberly's response is the reality is we have a structure that's not always postpartum friendly. And so we contend with the change that we want to see and the reality of what we contend with, right? And what Kimberly was suggesting is we focus on making sure that the parents have the information they need first. So those one-pagers and those maternal health warning signs, making sure that they're equipped and empowered. And there's also a unique opportunity to partner with community organizations that can help create an environment, a postpartum village, so to speak, where those who are in that similar season of entering parenthood can support one another, where this infrastructure may not be able to support that, right? And so in terms of just emotional and peer support, but also recommendations on where best to navigate certain things. And we have found that even through Citygate, just seeing the mothers communicate and discuss with each other, one parent was talking about how to navigate Medicaid as a Spanish speaker and who to talk to and all these different things. And so there's a lot of existing community infrastructure that does exist that can serve as the incubator of creating that village. And so, but in terms of what to implement first priority, the information needs to get to the parents first. Those one-pagers you can put in directly in the hands of individuals. The next priority, create that village. And thirdly, definitely change and modify the system so that we can make sure that everyone's getting consistent postpartum care.
Awesome. Well, thanks, team. I know we're at the top of the hour. I want to again thank our North Carolina partners. We could not have done this work without their support and encouragement. Thank you so much. And thank you, Maternal Health Learning Innovation Center, for this platform. Great. Well, thanks everyone for spending your Monday with us. We would love to hear from all of you. Thank you for sharing our resources, and we hope you have a wonderful week. Thank you so much.